From aching knees to stiff hips, joint pain is something millions of Americans live with every day. But for some, relief may come in the form of surgery. So we're taking a closer look at that today. Who's getting it, how the technology has changed, and why more patients are recovering today faster than ever before. Dr. Joseph Maratt is an orthopedic surgeon with Franciscan Health. Thank you so much for joining us.
Of course, yeah, thanks for having me.
So when you operate on someone and replace the joint, what are you actually doing? What are you putting inside?
Yeah, so the problem with hip and knee arthritis is that the cartilage surfaces that are supposed to be super smooth surfaces get worn down. And so we have to replace it with something that's just as smooth. And so usually we're going in and removing most of the joint and putting in metal and plastic surfaces that look a lot like that joint.
And I would imagine that this process has really evolved over time.
Yeah, it's pretty dramatic how different it is today than what it was like 10 years ago. I've been doing this for 10 years, and the implants have gotten better. The way we get into the joint has gotten better. The way we machine the space and put in the implants have gotten better to the point where now we're using things like robotic arms to help us prepare it and implant the devices in exactly the right place.
Wow.
It all just makes it so that it's an easier, better recovery for the patient.
Yeah, well, how much faster are people recovering once it's over?
And that's changed a lot too, and that's a lot to do with the techniques and technology, but it's also how we think about these operations. We do a lot of work ahead of time to get patients ready, to make sure they're medically ready, but also just prepared for what comes afterwards. And what used to be an operation where you'd be in the hospital for 3 days, now you come in on the day of, and most patients go home the same day. They're standing up, they're walking within hours of surgery.
Wow.
And yeah, that deep inside joint pain from hip or knee arthritis, it's just gone the day of surgery, so they want to be up and trying it out.
Yeah. How do you know when you need joint replacement?
Yeah, so I tell my patients it's never a need as much as a want, right? So there'll be a point when you have bad enough arthritis where it's a problem in your life, and eventually it'll get to be a problem that can't be managed with medications or injections. And then it just starts interfering with life in a way where you'll decide that I'm a candidate for a joint replacement and now I want one.
How can you put it off?
Yeah, and it varies depending on where you are, right? When you first start having symptoms of knee arthritis or hip arthritis, it can definitely be managed with simple things like medications like an anti-inflammatory or Tylenol over the counter can help. Physical therapy just to strengthen some of the muscles around the joint can help. And then a little bit more invasive things like steroid injections into the joint can definitely help calm down the symptoms. And it's when all those things don't work that you start considering things like surgery.
Let's talk about life after surgery. So you talked about the quicker recovery. What is life like? Are there limitations? Or am I going to have to do anything differently once I've had replacement?
Once you're fully recovered, for the most part, no. In the early parts, you have to modify things a little bit just to protect the implants, just to have a smooth recovery through. But once you're about 3 months out, it's back to life as normal.
Wow, it's pretty incredible how far we've come and just how minimally invasive an operation like that has become.
Yeah, the thing that you have to think about is it's still the same operation. It's as complex. It's as big a deal as it always was. It's just that we've made it so regimented. We've looked at it so closely that we've taken this complexity and made it simple enough that it can be done in a way that you're in the day of surgery and standing and walking 4 hours after a joint replacement.
If I'm thinking about having this done, do I contact an orthopedic surgeon like you directly, or is it better to go to my primary care doctor and get a referral?
It just depends. If you know that you've had this problem, oftentimes it'll be patients that know they have a hip or knee arthritis and they're just sort of putting it off for a while. And when you cross that threshold, you can come and see someone like us. If we need input from your primary care doctor about the safety of the procedure and things like that, we always reach out to them. There's a process for it, like I said. When you decide to have surgery, it starts this thing that goes backwards and looks at your health, looks at optimizing you, looks at the amount of help you have at home. And so we'll coach you through all of that.
All right, Dr. Joseph Maratt, thank you so much for being here.
Of course, yeah, thanks for having me again.